Question number first. The right subclavian artery arises from option A subclavian artery, option B common carotid artery, option C arch of aorta, and option D brachiocephalic trunk. The correct option is D. And the explanation: the arterial supply to upper limb begin in the chest as subclavian artery. So the right subclavian artery arises from brachiocephalic trunk. But if we talk about left subclavian branch, so it directly from arch of aorta. Next question: which artery contribute mainly to supply of thumb and lateral side of index finger? Option A radial artery, option B ulnar artery, option C deep palmar arch, and option D brachial artery. The correct option is A, because radial artery present on the lateral side and mainly supply to the thumb and lateral side of the index finger. If we talk about radial artery in anatomical location, so radial artery enter hand dorsally crossing the floor of anatomical snip box. Next question: what muscle does axillary artery pass beneath? Option A pectoralis minor, option B pectoralis major, option C subscapularis, option D bicep brachii. The correct option is A, and the explanation of this MCQ: pectoralis minor is a thin muscle, triangular muscle situated at upper part of the chest and beneath the pectoralis major muscle. It originates from third and fifth ribs and insert on coracoid process of the scapula. This is very important from examination point of view. Its origin, its location, and insertion. Question number 5. Which clinical sign indicate ischemia of forearm? Option A Volkmann contracture, option B ulnar claw, option C hand of benediction, and option D carpal tunnel syndrome. The correct option is A. Ischemia of the forearm agar, the condition is called Volkmann contracture. It is a permanent flexion contracture of the hand at the wrist resulting in a claw-like deformity of the hand and finger. Passive extension of the finger is restricted and painful. MCQ number 6. What is the name of deep artery of the arm? Option A radial artery, option B profunda branchiae, option C brachial artery, and option D axillary artery. First you should understand the question at what I am asked. The correct option is B, and the explanation: profunda branchiae is the branch of brachial artery, and the other two artery like radial artery and brachial artery, these are superficial artery, and profunda branchiae is the deep artery of the arm. Next question: femoral artery is second largest artery in the body. Option A true and option B false. The correct option is A, because femoral artery is the second largest artery in the body after aorta. MCQ number 8. Circulation takes blood from heart to lungs and back. Option A systemic, option B body, option C pulmonary, and option D blood. The correct option is C, and the explanation: pulmonary circulation is the process in which deoxygenated blood flows from the right ventricle to the lungs, and after oxygenation the oxygenated blood goes to left side of the heart like LA and LV, and then through aorta blood supply to the whole body. MCQ number 9. Which vein return blood from head, neck, thorax, and upper limb to the right atrium? Option A superior vena cava, option B inferior vena cava, option C pulmonary vein, and option D pulmonary artery. This is so simple MCQs, and the right option is superior vena cava. And the explanation: the superior vena cava returns deoxygenated blood from systemic circulation to the right atrium of the heart. It has a diameter of about 24 mm. This is very important from examination point of view. Next question: major superficial vein that empty into axillary vein drains superficial upper limb structure. Option A vena cava, option B splenic vein, option C femoral vein, and option D cephalic vein. The answer is D. An explanation: cephalic vein is a superficial vein in the arm. It also known as antecubital vein. Sometime examiner put antecubital vein in the option instead of cephalic vein, so you should remember this. Last question. Which artery carries blood to posterior compartment of legs? Option A dorsalis pedis, option B posterior tibial artery, option C lateral femoral circumflex, and option D internal iliac artery. The correct option is C, and the explanation: posterior tibial artery of the lower limb carry blood to posterior compartment of the leg in plantar surface of the foot. This is all about our MCQ session. Any question up to this you can ask in the comment section. Thank you.